If you ever go to get medical care at a teaching clinic, you are likely to spend some extra time and energy talking to doctors in training, like medical students, residents, maybe fellows, before you see the attending. And this may feel like something that you just have to put up with for the sake of advancing the field of medicine. You may wonder if there's anything in it for you as an individual. Well, I'm here to tell you that yes, there are actually several benefits to working with a team that includes doctors in training, several benefits to you personally. So let's talk about the teaching clinic experience, what's happening behind the scenes, and the value of that whole process for you as an individual patient. I'm Dr. Matthew Tyler, and this is How to Train Your Doctor. Alright, so let's first talk about your experience when you go to a teaching clinic. Once you're in that exam room, the first person you'll see is going to be the person with the least amount of medical experience, meaning like a medical student or a resident. And this is also going to be the person that spends the most amount of time with you, most likely. And during that time with you, they're going to ask you a bunch of questions, they'll do a physical exam, and at some point they'll leave and go get someone with more experience, and they'll return with that person who will ask you a lot of the same questions. They may repeat the physical exam, and this process will rinse and repeat until eventually you're in the room with the attending along with all those other trainees. And at that point, they'll share with you what they think is going on and what their treatment plan is going to be. And all this is annoying in a lot of ways, right? It's annoying to be asked the same questions repeatedly. You wonder if people are even listening to you, if they're talking to each other behind the scenes. It's uncomfortable to have to go through the physical exam multiple times. I mean, once is bad enough, right? And you just feel like you're wasting a lot of effort, a lot of energy, and a lot of time on the whole process. So let's take a minute to look behind the curtain. Once that trainee leaves your room, they're scurrying off to a back room somewhere where they're waiting for their attending to come out of another patient's room, and then they're going to present your case to the attending. And that's where they share what they found from talking to you, what they found from examining you, and what they think is going on with you and how they would treat you. And the flip side is that the attending is sharing, what additional questions that they would want to ask you to kind of get a better sense of what's going on with you. And they're sharing their initial thoughts about what they think is most likely happening and how they would likely treat you. Before they then go all back in their room, your room, together, and the attending asks those additional questions and shares their final thoughts about how to best take care of you.
Doctor?
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 So what does all this mean for you? Well, from a time point of view, you're certainly not saving yourself any time by not talking to the trainees because, as I mentioned, the attending is seeing other patients while you would be talking to a trainee. The clinic is designed around this. So even if you said no thank you to talking to a student or a resident, I mean, you'd save yourself some effort, but you certainly wouldn't save yourself any time because it's not like that attending is waiting to jump in as soon as the student's done. Their clinic is jam-packed. They're seeing other folks regardless of what you're doing with that trainee. But what about the effort spent talking to those folks? What about that process of going through the multiple questions? What are the benefits as far as that goes? Well, I think there are quite a few. And I think one of the big benefits for you is the repetition. So I don't know about you, but going to clinic and going to see a doctor, flusters me, it frazzles me. Yeah, I know I'm a doctor, but going to the doctor still frazzles me. I said it. And when I'm frazzled, I forget stuff. I can even forget important stuff. And if you're like me and being off your routine just sort of messes with your head, I think it's very helpful to have sort of a dress rehearsal, so to speak, by talking to a trainee like a student first, because it helps jog your memory and helps recall important details that you're going to want to share with the attending. So that's a nice benefit. The other benefit is that having the attending review your case behind the scenes in that back office with the trainee is a bit of a quality control measure for you. And what I mean by that is when the attending is talking to the trainee and sharing their feedback, and they're sharing what they think is going on with you, they need to justify that reasoning, right? For the sake of education, they're sharing their thought process. They're sharing their thoughts about the physiology and anatomy involved in your situation. And by talking out loud, it allows the attending to hear themselves and catch any potential errors in their logic that they wouldn't necessarily catch if they were just talking to you directly without that intermediary of a medical trainee to bounce their ideas off of. And certainly this doesn't happen all the time that they're going to catch an error, but it is a little extra quality control for you there. The third benefit is I think there's a lot to be gained from the different perspectives on having multiple medical people on your team, even students and residents. Meaning that you may meet a student or a resident that shares a similar background to you in some way that you just feel more comfortable sharing things with, potentially important things that could lead to the best treatment plan for you. Now, the parting piece of advice I'd like to give is that there can be a bit of an operator game when you share your story with a trainee and they go on to share your story with the attending. Meaning key details of your story may get distorted in a way that changes the way that you intended to share your story. So my advice is that you think of one thing that is super important about your story that you want to make sure goes directly from your mouth to the attending's ear. Maybe it's a key detail about your symptoms that you want to make sure gets conveyed. Maybe there's something you're worried is going on that you want to make sure the attending knows about so they can provide some reassurance about how likely that is or how likely it's not. Whatever it is, I would have that at the front of your mind because, again, the time the attending is in the room with you is brief. You may get flustered like me when they're in the room and you may forget that you wanted to share that. So have that ready to go from the moment they walk into the room to make sure that they hear it from you directly. All right, well, I do hope that you found this helpful and thank you so much for watching.